on the Gullian Barre syndrome. Let's discuss what is it. See, it is an autoimmune disorder that causes the immune system to attack the part of the peripheral nervous system. Okay, so it is a serious disorder that occurs when the body's defense system, that is your immune system, mistakenly attacks the parts of the nervous system, and this leads to inflammation of nerves, that means neuritis, that causes the muscle weakness. And okay, so the weakness and the tingling in your hands and the feet are usually the first symptom. So this sensation can quickly spread and eventually paralyzing your whole body. So we can say GBS, also called as GBS, the Gullian Barre syndrome, is potentially a life-threatening disorder. Let's discuss. So, Gullian Barre syndrome is an acute infectious neuritis, that means inflammation of your nerve or a neuron of the cranial and the peripheral nerves. Okay. So the immune system overreacts to the infection and destroys the myelin sheath. Here you can see this is the myelin sheath. So the myelin sheath generally allows the electrical impulses to transmit quickly and efficiently along the nerve cells. If it is damaged, or if the myelin is damaged, these impulses get slowed down or even stops in causing the neurological problems. Okay. So next, the syndrome usually is preceded by a mild upper respiratory infection or gastroenteritis. The recovery is slow process and can take years. The major concern is difficulty breathing. Okay. Let's discuss about its assessment. How to do the assessment. First is paresthesia. Now what is paresthesia? You can say is a feeling of numbness, burning and the tingling sensation, usually in the extremities, such as hands and feet, and that though in a symmetrical manner, like both the feet are affected, both the arms were affected, like that. So the weakness of the lower extremities will be there, gradual progressive weakness to upper extremities and the facial muscles. The possible progressive to respiratory failure. Okay. So next, cardiac dysrhythmias will be there. Dysrhythmias means abnormal and the irregular heartbeat. Okay. So CSF, that is your cerebrospinal fluid, that reveals an elevated protein level. So if we do the electroencephalogram, it will be abnormal. So the abnormal electroencephalogram will be there. Okay, like that we will assess this disease. Now what are its interventions? See, the care is directed towards the treatment of symptoms. So usually we did supportive treatment as well as the symptomatic treatment. We give symptomatic and supportive treatment. So monitor the respiratory status, provide respiratory treatments in case where the patient's ability to breathe is impaired, he or she is usually put on the ventilator. So prepare to initiate the respiratory support like that, and monitor the respiratory cardiac status, assess for complication of immobility, provide the client and the family with support. Okay, that is all we can do. So these are the interventions. So today we have discussed about the Gullian Barre syndrome, how to assess that and what are its intervention. Hope this small video is clear to you all. Thank you.